like we said, the brain has different areas that grow at different speeds. So is the rest of the body, pretty much. So a growth spurt is basically all of that sudden, rapid physical growth that we're going to see the adolescent experience. But they're not going to experience it in their body at the same rate. So, for example, they're going to notice that they are gaining weight more rapidly or faster than they are gaining height, for example, or that they are going to have their extremities or their limbs grow faster than their trunk or their torso. So you end up with these big-footed, long-legged teenagers, and sometimes it poses a hardship for the parent to find fitting clothes. This is one of my favorite pictures because it's one of those reminders that at a certain stage of development, it becomes really hard for a parent to find the correct fitting jeans for their child. They're either too loose or too tight or too short because the waist is not consistent with the height of the child. Of course, when, where, and at what speed does this happen, it's all connected to, again, nature and nurture together. So you've got heredity, you've got hormones, and you've got, of course, the diet and exercise that's going to affect that growth spurt. Typically, by age 17, the average girl, for example, will have twice that of her counterpart, the male, in body fat. And this also is attributed again to the mechanism, the hormonal production, and the diet, and the metabolism of the body given her gender. In other areas, we're going to see that after weight and height comes muscle growth. And muscle growth is pretty unisex when it comes to both males and females will gain similar, on average, development of their muscles, except for arm muscles. Arm muscles tend to be developing at a faster rate with boys than it is with girls, but other muscles are pretty much gender neutral. So with other parts of the body, internally, you will notice that also the lungs are going to gain development, and they will triple in weight. The growth is going to allow the adolescent to endure probably longer periods of exercise and activity level. Adolescents breathe more deeply and slowly. So by that, they are taking in more oxygen because of that size of the lung, and of course, not needing to take more or rapid breaths. Heart is going to also increase in size, so it's going to double in size. And when the heart, the container of the blood, is going to be bigger, that means that the heartbeat is going to slow because it doesn't need to pump as much. It's taking in more, so it's not working as much, which decreases, of course, the pulse rate and increases, of course, the blood pressure because there's a lot of fluid inside the heart, the blood. All right, red blood cells increase in both sexes, of course, but of course it dramatically increases in boys who tend to engage more in more exercise, and we will see actually a negative result during puberty on girls due to menarche and the loss of blood on a monthly basis. Skin and hair, I think these are things that everybody can relate to. During puberty, the skin is going to become more oily, and this has to do with the hormones and the secretions in the body. Of course, hormones also trigger the sweat glands, and combined, the oil and the sweat kind of produces a kind of an environment for acne. Hair On one hand is going to be growing in multiple areas in the body, and it's also going to become more coarse and dark. And of course, this is one of those examples of secondary sex organs, as we will describe in a minute, that kind of be the hallmark of puberty, which distinguishes boys during this stage. Diet deficiencies are going to be a result of this development, because you've got two things going together. You've got the hormonal changes in the body that are affecting the circadian rhythm of everything, the night and day cycle of sleep, of metabolism, of appetite. And you've also got this psychological effect of wanting to be independent. So the you know the sitting down of a adolescent to have a family meal and or have a family prepared or packed by their parent is going to become a little bit less and less, and therefore that independence is going to affect the intake of probably not as healthy of a diet as they would have in their earlier years. Deficiencies tend to be in iron, calcium, and zinc in particular. We're going to see also a decrease in iron, particularly in girls, due to menstruation. Now, the contributing factor to this is, of course, you've got a society that is, we're already established, that is obese, is unhealthy. And the food choices, if they were not set from early on as a child to be trained on what is healthy and what is not, and how to make sound judgments. When you are a teenager and you're trying to gain your independence, and you're with your friends, and you're eating late at night, and you're in a society that promotes things like fast food, you will tend to consume much less healthy and more unhealthy choices. Price plays a role too. Usually, unhealthy choices are cheaper, and when you're on a budget as a teenager who might have some allowance, you're probably making wise choices financially, but unwise physically. Rates of obesity are falling in childhood, but not in adolescence. So yes, we are seeing a positive trend, even though the United States is overall obese, or has high obesity in all categories. Adolescence tends to be one area that we're not making any progress. Now, body image has something to do with that. Of course, when you're consuming unhealthy food, you are gaining unwanted weight. However, you are part of a society that pretty much dictates what's acceptable and what's desirable when it comes to body shape. So being a teenager, already you're predisposed to all of this, and you tend to want to fit in, of course, because psychologically you are prone to want to be wanted. And the anxiety about your body image is going to contribute to, of course, not healthy eating, but rather resorting to shortcuts. And this is one of the reasons why a lot of teenagers tend to be falling for food disorders, as we will discuss in the next two slides. So because of the fact that they focus on their body, and they have the let's say the ability to see things from a different perspective, instead of really seeing it realistically to what it accounts to, they tend to exaggerate imperfections and see them from this egocentric mind. you will see statistically that about 1/3 of the United States high school girls, for example, are trying to lose weight, even though only 1/6 are actually overweight. So this is the amount that's trying to lose weight, and this is the amount that should really be trying to lose weight. So what is this portion doing? Well, this portion is resorting to losing weight because they are dissatisfied of their body image, because they are not fitting in their mind, they're not fitting a particular frame or a particular look that society is trying to sell them. So they fall trap into what is called eating disorders. And there are three type of eating disorders that we will discuss. The first one is anorexia nervosa, and this is basically an eating disorder that is basically characterized by starving yourself. So the individual who's unsatisfied with their body image will starve themselves and consequently starve their organs because they're not getting enough nutrients when they starve themselves. And the effects of it is that you will lose the weight, you will become very thin, but also you will be risking organ failure, because that thinness is not just the fat, but you're actually losing muscle and you're shutting down your systems. Bulimia nervosa, on the other hand, is an eating disorder that is basically characterized by eating. You're going to succumb to that feel of wanting to eat, but because you don't want that food to go into to become metabolized and go into fat, you purge or force yourself to vomit what you just ate, or induce it through laxatives, so that before your body starts to absorb it, you're getting rid of it. Of course, this is not done only once. This is done on a regular basis, which will by default create a problem with your esophagus, or the route that the food is coming out from. So your GI tract is going to be affected and damaged. Of course, you're not just talking about your teeth, you're not just talking about your GI tract, you're also risking a cardiac arrest because of that electrolyte imbalance. If when somebody gets a flu or gets sick and they have diarrhea or they have vomiting, then one of the most important things to do is to supplement your body's electrolytes. So you're drinking water, you're taking those water solutions that have electrolytes in them, and to make sure that your body is hydrated. But when you are doing this without, of course, recovering that lost electrolyte, then you are suffering or risking the chance of falling into cardiac arrest. Another type of eating disorder that was actually newly added to the DSM-5 is binge eating. And binge eating tends to be this intervals of, overeating, indulging in everything that you want to eat, and you do it for like a period, the duration of like an hour or so. You eat, you eat, you eat. At the beginning, you're enjoying what you're eating, but then you lose track and you kind of zone out, and you just kind of like you wake up and found out that you have eaten this many wrappers or this many boxes. And engaging in this, of course, you're not purging, you're not getting rid of it, you're keeping it. And of course, once you realize or kind of wake up from that, you realize that you have consumed this much food, and you feel ashamed and you feel powerless. And you're doing it in hiding, in private, because you feel the inability to control yourself. This is diagnosed if it occurs once weekly for 3 months, or about twice weekly for about 6 months, usually when it kind of fits the diagnosis, and it's something that needs to be treated. Let's see. All right, so what is the origin of these eating disorders? Of course, we said that puberty has something to do with it. Puberty is going to kind of mess up with our hormones, and hormones are going to mess up with our systems. But this is not just this is not the only reason for over eating or falling trap to eating disorders. Cultural image, like I said, is also a big factor. Wanting to fit in, wanting to look a certain way is also going to affect how we perceive ourselves and how we abuse our bodies in order to fit into that model. Stress tends to trigger eating disorders. Of course, childhood patterns is basically the foundation. So if I have healthy eating habits in childhood, I grow up to be a healthy eating adolescent. If I don't have that established and engraved from early on, it tends to be really hard to fall into that as an adolescent. Eating together during childhood, family function is also helpful in remedying and preventing those eating disorders.